This video will review how to respond when a medical emergency occurs at school. A MERT is a medical emergency that occurs at school. MERT stands for Medical Emergency Response Team. When someone has a medical emergency, they or someone nearby should call a MERT, and then the MERT team will respond immediately to their location. Each school building in our district has a MERT team. This team is trained annually on how to properly respond in a variety of situations. Reach out to your building administrator to find out who is on your building's MERT team, and let them know if you have interest in joining the team. Each MERT team has a large bag or kit with first aid supplies called the MERT bag. This bag is kept in the office, but a team member will grab it on the way to respond to the emergency. The MERT team will also bring the AED to every MERT call in case it is needed, as this shortens the response time for cardiac events. The MERT team is trained annually on the use of first aid practices including, but not limited to, emergency medications such as EpiPens, Narcan, rescue inhalers, seizure medications, etc. They are expected to respond to any MERT call and provide initial medical care. The MERT team will also decide whether or not to call EMS 911 is not automatically called when you call a MERT. You can call a MERT from any school phone. All of the black ShoreTel phones found in classrooms or offices should have a sticker that gives the 4-digit code to dial for a MERT. Once you've dialed that number, the overhead speakers will come on and state MERT team needed, and it will give the room number that you dialed from so that the team knows where to go. Look for this number on your classroom or office phones today to make sure the sticker is there. If the sticker is not there, please reach out to facilities to get one as soon as possible. The number is also listed on the emergency procedures flip charts found throughout each building. This 4-digit number is different in each school building, so if you work in multiple buildings, it's important to familiarize yourself with this process. If you are not on the MERT team when a MERT is called, you should go into secure mode. This means you should keep students out of common areas, like the hallways or bathrooms. Close classroom doors and close window blinds to provide privacy to whoever is dealing with the medical emergency. You may be asked to cover someone's classroom if that person is on the MERT team. This is something that would be discussed with you prior to an emergency occurring. All MERT team members should have a plan in place for who will cover their students so that they aren't trying to find coverage during an emergency. Please note that if a plan is made for you to cover for someone during a MERT, you need to include that information in your sub-plans. If you call a MERT, do not panic. Stay with the person until help arrives. Once they arrive, the MERT team may ask you to clear the area of bystanders. They may also ask you questions about what happened, so that they can respond appropriately. Once they have a grasp of the situation, they may ask you to leave. This is not because you did anything wrong. They have simply been trained to remove non-essential personnel to provide privacy and clear the area for EMS arrival. If any documentation is required from you after the situation has been resolved, a member of the MERT team will let you know. While you may be emotional after this type of event, it is important that you do not share any private medical information with others after you leave the situation. A MERT should be called anytime there's an urgent need for medical assistance. This would include seizures, fainting, breathing difficulties, severe bleeding, anaphylactic reactions, choking, drug overdose, and much more. Calling a MERT does not immediately call 911, so do not be afraid to call a MERT if you need medical help. One type of emergency that would require a MERT call is a seizure. 3 key words to remember if you witness someone have a seizure are stay, safe, and side. Stay with the person for the entirety of the seizure. Never leave a seizing person alone. If possible, however, have other students or bystanders leave the area to provide privacy to the person having a seizure. Time the seizure and check for a medical alert, ID, or bracelet. Keep the person safe, moving dangerous objects away from them, and protecting them from injury. Do not restrain the person that is seizing. If the person is not awake or alert after the seizure, turn them onto their side while you wait for help to arrive. During a seizure, it is important to keep the airway clear. You may have to loosen tight clothing around the neck like scarves or hoodies. You can also support the person's head by placing something soft and small like a sweater or pillow under their head. Many people with known seizure disorders will have a rescue medication prescribed to them for emergent situations. If this is the case, the medication should be given as prescribed. You should call a MERT for any seizure that occurs. 911 should also be called if someone is having a seizure that has never had one before. For people with known seizure disorders, 911 does not need to be called for every seizure, but should be called if a seizure lasts longer than 5 minutes, if the person has repeated seizures, if the person is sick, injured, or pregnant, if the person is having difficulty breathing, if the seizure occurred in water, or if the person does not return to their normal state after the seizure occurs. Another type of medical emergency that we should always be prepared for is cardiac arrest. If a cardiac emergency does occur, please follow proper protocol. Send someone to get an AED. Call a MERT to get immediate assistance, and call 911. Clear the area of students and non-essential staff. Start CPR, utilizing the AED as soon as it arrives. There are regularly maintained AEDs in each school building within the Big Rapids School District. Please familiarize yourself with where the AEDs can be located for the buildings that you frequent. AEDs are placed in specific locations with the goal that one can be brought to any area in the building within 3 minutes of a MERT being called. The American Heart Association has a chain of survival with 6 links. A strong chain of survival can greatly improve chances of survival and recovery for victims of cardiac arrest. The 6 links of the chain are early recognition of cardiac arrest, early call to 911, early start to CPR and early use of AED, then early EMS arrival with EMS advanced life support. CPR can be broken into 8 essential steps. Before you even start CPR, you must assess the scene for safety. For example, you would not do CPR in the middle of a busy road as it would not be safe. You should instead move the person to a safer spot or find a way to secure the area before you proceed. Once you've established that the scene is safe, you should check to see if the person is responsive by tapping their shoulders and shouting, "Are you okay?" If the person does not move, blink, or respond in any way, you should call a MERT and 911. Put the person on a firm, flat surface, this is oftentimes the floor. Kneel or stand beside the person depending on the surface, and prepare to begin CPR. Place both hands at the center of the chest. Push hard and fast on the chest, pushing down 2 inches and allowing the chest to rise between each compression. Give 30 compressions at a rate of 100 to 120 per minute. Next, you should give 2 breaths. Lift the chin and tilt the head back to open the airway. If you're not using a pocket mask, you need to pinch the nose and seal your mouth over theirs to give breaths. Watch to see the chest rise. If it doesn't, put their head back in neutral position before trying again. If it still doesn't rise, there may be something blocking the airway. You only have 10 seconds to give breaths before resuming compressions. Cycle through sets of 30 compressions and 2 breaths until an AED arrives. Turn the AED on and follow its automated instructions. If you have any questions, please reach out to the Big Rapids District Nurse Laura James at